thanks. Welcome all to this Subject Overview and Scrutiny Committee 2 meeting, which, due to government advice to the public to practice social distancing, will be held virtually with committee members and officers accessing the meeting from remote locations. The meeting is being recorded and will be available via the Council's website to be viewed subsequently. Please can everyone ensure that all mobile phones are switched off or to silent mode. Members will have received an electronic copy of the agenda on Thursday, 4th of November 2021. For the record, the agenda can be viewed on the Council's website. Members and officers will be speaking at various points during the meeting, and those speaking may switch their cameras on at that point, but I would ask that, with the exception of myself as chairperson, at all other times you keep your cameras and microphones switched off, as this will help to minimise any background noise and interference and to ensure the connection remains as stable as possible. Please do not use your microphone until I invite you to do so. Officers from Scrutiny will be supporting the meeting and will be monitoring the use of microphones throughout the meeting, and where necessary will mute those not being used. If any members wish to speak to raise a point or question, they should please click on the raise hand button at the top of the Teams window and I will come to you in turn. Please do not use the instant messaging chat to enter questions or comments. I will now ask the Scrutiny Officer to announce the names of the councillors in attendance at this meeting.
Thank you, Chair. The members of the committee in attendance are Councillor Mike Clark, Councillor Jane Gebby, Councillor Martin Jones, Councillor Mike Kern, Councillor Anel Pacella, Councillor Gary Thomas, Councillor Ken Watts, Councillor David White, and yourself, Chair, Councillor Amanda Williams.
Thanks very much. And have we got any apologies for absence?
Thank you, Chair. I've received apologies from absence from Councillors Pam Davis, Councillor Mary Hughes, Councillor Janice Lewis, and the head of Adult Social Care, Jackie Davis.
Great, thanks very much. I've not had any other apologies either. If we go on to item number 2, has anyone got any declarations of interest? If you have, can you put your hand up and I'll come to you in turn. Councillor Burnett.
Thank you, Chair. Yeah, I'm afraid due to I have a close family member who is entered into a conflict with Children's Social Services, which means that because of the member's code of conduct, that would be seen as a prejudicial interest on my part, and I will not be able to take part in this meeting on the advice of the monitoring officer. So apologies everybody, but I can't take part in this at the moment, and I will have to leave. If anybody has any questions to me as cabinet member, you can contact me by other means. Apologies.
No problem. Thanks very much. Then we've got Claire Marchant.
Thanks very much, Chair. I need to advise of a personal interest in respect of a close family member who is supported by a social worker in one of our adult teams. It's a personal, not prejudicial interest, so I'm able to participate in the meeting.
OK, great. Thanks very much. And Councillor Aspey.
Yeah, apologies for the late joining of the meeting. I had a few IT issues with the computer. I will have to slightly dip out at 10 o'clock. I've got a phone call with the Ombudsman, so I will rejoin, but I will have to drop out around about 10 o'clock. Is that OK?
Yes, that's great. Thanks for letting us know.
Yeah.
Thanks. Right, I can't see any other hands up for any declarations of interest. Oh, Councillor David White.
Just to generally make declarations for family interest and things like that. My wife works for Children's Social Services. Am I okay to stay?
Meryl, I don't know if you want to advise here.
Chair, the report we're considering, we're not actually making any decisions, so I would say that it's okay for Councillor White to stay and continue with the meeting.
Great, thanks very much.
Thank you, Meryl. Thank you.
Okay, no others. Oh, Councillor Aspey, you've still got your hand up. Did you want to come back in?
Oh, apologies.
That's okay. Okay, I think that's it. If we go on to item number 3, and it's the approval of minutes of the meeting held on the 15th of July. Has everyone read the minutes, and is everyone happy with the content?
Move. Yeah, second, yeah.
Yeah. Councillor White, your hand is showing on my system. I don't know if it's still up. Great. Okay, that's fine then. We'll move those. Then we'll move on to agenda item number 4. So if I can ask the officers, I believe there's a few officers in the meeting to present the report. Could we also, we had a pre-meeting before this meeting, and the committee asked if we could possibly have a bit of an executive summary with some points as well with regards to where we are with this as well, please. You might be doing that as part of your presentation anyway, but just so that it's noted. Thanks.
Thank you very much, Chair. If it's okay with you, we'll go straight into the presentation, and hopefully that will cover off the request for the executive summary. But obviously, if there's any points that require further clarification following the presentation, hopefully we can address that during the questions. Could I ask scrutiny officers if they're able to display the presentation, please?
Yeah, I'll do that now.
Thank you very much. And whilst they're doing that, if I could just, as you've indicated, Chair, this is going to be a team effort between myself and colleagues across adults and children's services. And I think we're really excited to present to Scrutiny Committee this morning the progress that we've made and the work that there is still to do in embedding strength-based practice in social services here in Bridgend. We have colleagues here this morning alongside me from Children's Services, and that's our Head of Service, Laura Kinsey, Group Manager, Ian McMillan. From Adult Services, Carmel Donovan, who is the Integrated Community Services Manager working across the Health Board and the local authority, but leading on social work practice for us. And then Claire Holt and David McManus from our social care workforce development team, who are really key and critical in supporting practitioners to embed strength-based working. So we've got a number of colleagues here this morning, and we're hoping it'll be a really good discussion. If we move on to the next slide, if that's all right, I'll just introduce a little bit about what we mean by strength-based practice. We've been talking about strength-based working in social services across Wales and in Bridgend for, I think, coming up really for almost 10 years now, which is amazing when we think back. Groundbreaking for us was the work leading up to and the implementation of the Social Services and Wellbeing Act, which is legislation which came into effect in 2014, but it was implemented fully from 2016, but a lot of work was done in the lead up to the implementation of the Social Services and Wellbeing Act to move us from what had been seen as really a deficit model of practice in which we focused on. We understood in quite granular detail the risks that individual situations presented, and we put in place care plans and ranges of services to address those risks and to support and mitigate those risks. As we moved forward into strength-based working and practice, a lot of time was taken to really change both practice but critically culture, and to work with individuals and with families in the context of their lives to understand both what's wrong but also critically what's strong, and to understand what matters to people, and you'll have heard a lot about what matters in sort of the parlance around social services and wellbeing over the last number of years. In understanding what matters and people's capabilities and relationships, coming out of that, people are able themselves very well to articulate the outcomes that they are seeking to achieve within their own lives. And for all of us, in seeking to live the lives we want to live, there will be things that we want to do, and all of us will face barriers to doing the things that we want to do, be it in terms of employment, be it in terms of housing, be it in terms of education, be it in terms of the care and support we need to fulfill our basic daily lives. And this leads us to quite a different model of practice, which at its heart has outcomes identified by individuals and a very flexible approach, not led by services, but led by understanding the resources that individuals have within their own lives, within their communities, with services sometimes supporting people to live those lives that they want to live. It really is quite a significant culture change. It doesn't mean that we don't need to work in quite a lot of detail to still understand risk, but that we, in understanding those risks, work really hard with individuals and within family settings to manage and mitigate those risks in a different way. So we've talked about strength-based practice for a long time. One of the reasons I think we brought this report forward is that whenever we get into budget setting rounds, there is a financial consequence to strength-based practice. And actually what we've seen over quite a number of years is that we sometimes need less care and support for individuals, and there can be actually a budget saving by working in a strength-based way. But that's really not the starting point for strength-based practice. Strength-based practice is about enabling people to live really fantastic lives, to achieve employment, to have the social lives that they want and need. And I think some of this will be brought alive for you now in the rest of the presentation as we start to get into some real examples. So I'll hand over now to my colleague from Adult Services, Camille Donovan, and she'll take you through some of the journey that we've been on in Adult Services.
Thank you, Claire. If we could move to slide 3, please. So we're hoping to show you a film, I hope the tech works, about this gentleman called John who lives locally here in Bridgend. John's supported by our Community Independence and Wellbeing team, a team that works with people with complex long-term and often adverse conditions. And he's supported by a local provider, Elder Care, who's one of our independent providers. And the team worked collaboratively with that provider to support John by focusing on understanding what mattered to him and developing interventions that focused on his strengths and capabilities and support was important to him. So just to give you a bit of context, really, when John left hospital, he'd been assessed as needing 105 hours of care per week, as well as care throughout the night. Following the work by the social work team and the provider, over time, that is reduced from 105 hours to 25 hours a week, and he has no support at night. So a lot of resonance to what Claire was just explaining in terms of how working with people with what matters to them can make a significant difference all around, really. You'll see in this film, John wanted to be independent and confident and control his own life. His lifestyle and alcohol abuse had significantly impacted on his ability, and he had become disconnected to his family. And he was absolutely, he had really strong resolve and commitment to take steps to change and improve his life. And he wanted to be enabled, you know, not through a controlling relationship, but through one that supported him. And what was really important to John was to reconnect with his family and reconnect with his friends and have a purposeful life. And John has started to, you know, participate in activities, but really importantly, he's been able to help others who attend daytime activities, and he's felt able to contribute and not just be a passive recipient of care as he might have been under the former legislation. So this film is introduced by Christine from Elder Care, who was key in supporting him, but also you'll hear from John about his reflections on his life, and he has consented to us sharing this film, a film that is a couple of years old, because as you'd appreciate, we haven't been able to film during the pandemic. Anyway, let's hear it from them first, and fingers crossed the tech works.
Eldercare has been supporting John for a number of years. He's a young man in his 50s, and due to alcohol misuse, his short-term memory was impaired a lot. Initially, he had a 24-hour care package, which over the years now we've gradually reduced at his request to enable him to lead a more fulfilling life with things that matter to him. One of the main things initially was the mending the relationship with his family, which the social worker John and myself looked at, and John mended that by inviting his brother-in-law to visit once a week, which gave him a connection with his again, which evolved into him being able to go to their house for things like Christmas Day, Easter Sunday, and John always came back buzzing with all the family he'd met, the children, etc. And it really gave John a purpose to his life again. The next thing was making sure that his Monday to Friday day was more structured, and he wanted a variety of things to do. So we split he went to visit different social activities in the area and decided that he would like to go a couple of days to one, a couple of days to the other. Although recently he has shared with me that his favourite day of the week is the day where he goes where people have far worse disabilities than him, but he is helping them on that day, and he says that gives him a good feeling and that he feels more valued because he is giving something back. The other thing that John wanted to do was to meet friends of his once a month to go out for an Indian and have a catch-up, a gang of men together. Initially, we thought about it and was quite wary because of the alcohol being in the premises, and would John want to join in if the other friends were drinking, but John assured us he wouldn't, and so he's been going there now for about 18 months, once a month, and it has really been really good for him, and his self-esteem has been risen because of it, because he feels he's mixing and having the normal life. Recently, over the last 12 months, we've been working, because John feels more confident and has requested that he would like to spend more time in his home without support there, as long as the safeguards are in place. So Rhiannon, John and myself have sat down and worked out a timely plan, which was started about a year ago and slowly has progressed now to John having a lot of time at home on his own, which he is now feeling more confident and in charge of his own home, which has left him to feel that he has got a much more fulfilled life.
I started going to Glanreed because I had a drink problem, and I ended up staying there for quite a while until Eldercare looked after me, took me out of Glanreed and set me up in a flat in Anisawdra, and Chris and her friends looked after me, made me show the errors of my ways, and since then I've come on leaps and bounds since we're becoming much better, much more confident and much more happy with in charge of my life completely. Yeah, it's important for me to have my own time and my own things for me to think of what to do and where to go and looking after the flat. I've mended the relationship between my brother-in-law and my sister from the time when I was a bad boy, go drinking alcohol and putting them in, wondering what I was doing. And everything seems to come around a bit now. They started trusting me a bit. the things I'm really thinking are important to me are the way the flat has gone, the things that we do with the different centres, and really the support that I've had from elder care, and all the carers that come to my house and look after me, and the way I go to the Indian and on a Friday, I really enjoy it. My friends have come back, they really supported me. I think it's definitely turned my life around since I've started coming with elder care and with all the staff that come around to see me.
You've been a pleasure to support, and
Thank you.
It's great to see you come on so much.
Thank you.
And start to, because it's important for the carers as well as you that they can see some reward that you've turned your life around.
Yes, I am.
You're having
definitely
such an enjoyable life.
Exactly.
You said to me that you never thought you would get back to.
No.
And when I said to you, you're not going to go out and buy alcohol.
No way. Definitely
said,
not.
I am never
No
going
way.
down that route.
No, definitely not.
And that's lovely.
Yeah,
the,
exactly.
Support services.
Yeah.
So John's story is just one example of, if you take a different approach, you can deliver different outcomes really that are beneficial to him as well as to us as an organisation really. So I wonder if we could go to the next slide, please.
Service.
Okay, so if I may, I'd like to take you through our journey in adult services and tell you how we've developed by layering in year on year and embedding this way of practice throughout our service. So as the director's already explained, this is a strength-based approach that focuses on people's outcomes and focuses on what matters to them and ensures that their voice is heard in shaping their care and support. And it's a principle of the Act that we practice in this way. And it's really essential that we focus on helping people to live as independently as possible by focusing on their strengths and capabilities as well as those of their family and the resources of their community to assist them in achieving their well-being outcomes and to live as independently as possible. And John is a good example of someone in that journey whose life may have been very different had we been working under the former legislation, which Claire also alluded to, which it did give us a duty to focus on what people couldn't do and was a deficit model of assessment. And the context to understand why this was such a challenge to change practice is that, you know, for more than 20 years, our staff had that duty to focus on what people couldn't do and meet need by providing services to assist them with those areas. So to implement strength-based practice in adult services, we had to enable a culture of change and a shift in thinking. Our professionals, you know, our professional staff and how they worked with people, and to encourage them to and enable them and empower them to focus on what mattered to them and what outcomes they wanted, and to learn how to encapsulate those well-being outcomes for people into co-produced plans of care and support. So there's a rebalancing of how we worked as well with the people we worked with. So 2016 really was a year of knowledge-based training, focusing on the duties and responsibilities of the Act, including, you know, well-being outcomes, strengths, independence, prevention, early intervention, choice, voice and control. But we shifted our focus in 2017 to look at skills, investing in supporting our supervising practitioners, our managers, our assistant managers, our senior practitioners to support staff effectively in this approach. Coterminously, we also trained our staff to utilise tools like action learning that enable people to share practice experience and to learn from those practice experiences. We also commissioned collaborative communication skills for staff in this year so that social workers would have skills and techniques to enable them to have those strength-based conversations. And we developed a new supervision policy to explicitly focus on outcome, strengths, and reflective practice. We also then developed quality assurance tools to track evidence of that shift in practice. In 2018-19, we really continued to reinvigorate social work by consolidating. We focused on practice tools to assist practitioners to better record their assessments, their strengths, their outcomes, and there was training on implementation of our supervision policy. 1920 was really focusing on consolidating all this practice, but also considered how practice could be supported. And this included a number of initiatives to support this work, including reviewing and revising our e-practice guide for social workers, encouraging learning and sharing of good practice across teams, and improving processes for the recording of assessments. 2020, a year interrupted for all of us, really, the pandemic. However, the impact of the COVID restrictions meant our staff had to sustain people and their carers in very different and more imaginative ways. If anything, during this time, people's strengths, resources and capabilities became more important to acknowledge and sustain when other community offers were significantly restricted and limited. We've had to think about how we support our staff to reflect on the challenges of working in the pandemic and their ability to find creative solutions. There's been a greater need for them to for strengths and their carers' resilience, and to evaluate practice and incorporate our learning from practice in the pandemic going forward. So our next steps really will be to refresh, review and learn and develop activities from the induction of our new staff right through to skills-based training for our more experienced staff. Can I have the next slide, please? Thought you might be interested just to have some examples of how we changed our practice during the pandemic. And welfare calls during the first part of the pandemic were a tool we used really because we were all in a situation that we'd never experienced before, and we were very concerned about the most vulnerable people in our community. So we proactively called people. So for example, every single older person was rung every single week initially to see how they were managing and whether they needed different types of support. The lockdown sometimes locked out the very support older adults particularly relied on from their family and their friends, who were now sometimes shielding or isolating. Others were really fearful of having carers in their homes, and this brought other risks to individuals, which took some innovative planning by the social work staff with people and their families. Over time, we were able to risk assess everybody and analyse their strengths and capabilities and resources to manage in such a restricted time. People were extremely positive about the work we did with them, and they collaborated with us in order to feel safe and supported. In fact, people were extraordinarily resilient. What mattered became what mattered most to people, and we worked in a way that enabled people to take control in this extraordinary situation and remain safe and confident, and most importantly, well. As you'd imagine, most of our contact in the pandemic has been remotely through telephone contact, video calling with families, but we also continued to visit people when it was necessary, and we continued to assess people throughout the pandemic, implementing significant risk assessments for people as well as for our staff to ensure that we could continue to meet our duties and responsibilities. Could I have the next slide, please? So you'll see on this slide, our regulator is consistently positive about our social work practice, and that it is person-centred and outcome-focused, and there is good evidence in our care and support plans that we are taking account of people's views and wishes, particularly in their assurance check in April 2021, where they commented, as you can see at the end, overall in adult services we found an outcome-focused approach was embedded in and this supported co-production and identification of personal outcomes. People's views were sought and their voices were heard. Excuse me, could I have the last slide, please? My last slide, sorry. So a more recent example is this story of A, we're calling him A. He's a 20-year-old man who lives with Asperger's syndrome. He was referred to our common access point earlier this year following signs of stress and negative behaviour towards his family carers. It was identified there was significant carer strain and a potential need to support A in a different way. A became really anxious and frustrated with the COVID-19 restrictions, which had impacted on his routines and prevented him doing the activities he enjoyed. So he was assessed using a strength-based approach. And the social workers used strengths-based conversational approach with him and his family, and they identified he needed support to strengthen his abilities to engage in his interests and develop his independence and his network of support outside his family. His personal outcomes were to improve his emotional well-being, improve his family relationships, and his family's outcomes were to reduce the caring strain. A had not had any structured routines or activities since his college course had ended, which had been further impacted on by COVID-19. This meant he was not able to continue to learn and develop his skills nor build on the skills he had already developed. He'd always enjoyed speaking about his interests and proud of his previous achievements. He wanted to continue to progress and achieve, and he wanted to leave home and live independently. And he certainly had. In addition, there was a carer's assessment for both his parents, which identified that they had had no break from supporting him, and this had unintentionally prevented them from seeing their other adult children, and this had caused strain within the family. So a mutually agreed plan of care and support was agreed, and community groups of interest were identified for A, in addition to a direct payment, which he used to access the community organisations which offered a range of activities that could be tailored to his interests and focused on promoting his independence. It also offered him the opportunity to develop social and support networks that were separate from his parents. So I guess what difference did it all make? Essentially, the direct payment enabled A to begin to develop a new structured routine going forward that he controlled. He was moving to a new stage of his life following the completion of his formal education, and he was looking to the future. His main ambition and most important outcome was to move out of the family home. The direct payment was a way of supporting him to work towards this by beginning to develop his independent living skills. And he felt motivated and excited to be starting new activities and having new opportunities. His parents also felt that the strain had been reduced on them and they had more time to support their other children, but also their concerns regarding A and his well-being and his future were reduced. So by utilising strength-based practice, we're able to focus on what matters to people and deliver good outcomes, and we want to consolidate moving forward in our work to ensure that we do not lose this approach in adult services. I'm now going to hand over to my colleague from Children's End.
Thank you. Hi, can we move to the next slide, please? Okay, so it's Laura Kinsey here. So I'm going to talk about our journey to date in children's social care. So we were a bit sort of later in terms of starting on this journey than adult services, primarily because they were involved as one of the pilots in Wales when this framework and approach to practice was first introduced. So in children's social care, as indicated on this slide, really, similar to what Carmel described, really, after lots of broader training connected to the Social Services and Wellbeing Act in 2016, we continued to drive forward this agenda in relation to focusing on outcomes in our day-to-day practice. And what I'd say is it's continued to be a golden thread really in our conversations between one another as social workers, with children and young people and the families that we work with, and in all of the training that we provide to children's social care practitioners, regardless of the subject. Outcomes is always mentioned in there and focused on in some context. So I think as well, without repeating lots of what Carmel has said, though, I think it's important to emphasise as well that, like she described, this was the beginning of a journey, and it was, you know, a changing culture for lots of people, particularly lots of experienced social workers who had worked very differently in the past with children, young people and their families as well. So I think it was a big step change for them, and we are still on this journey as well. So I think what the slide describes really is some of the things that have been happening in children's social care over the last 4 or 5 years. We've done similar things in that in 2017-18, we provide staff with training on motivational interviewing techniques to enhance the conversations that they were having with people they worked with, and to help them determine what mattered to children and young people and their parents and carers. We also, the BART model is mentioned there, and I know we've described that in other reports about other parts of the service, but that was when we introduced a whole system approach to improving outcomes for children and young people. And that training particularly focused on the impact of trauma on children and young people, the resulting issues and behaviours, and how we should respond to those, and how that should inform assessments and interventions. So that was another key thing that we introduced a few years ago. We finally launched the outcome framework in sort of, you know, it's to its full extent really last year in 2020. We'd aimed to do that pandemic, and challenging time, and there were conversations about whether we should delay it, but we felt we shouldn't. It was really important, and we knew we could still go fully live. We were confident we could do that whilst in the midst of the pandemic. So we went live last year, and we had all the tools available to practitioners through our intranet pages and interactive practice guidance. And we also finally had all the recording documents the practitioners needed to equip them to work in this way fully on WCCIS as well. So all of that went live fully last autumn 2020. So before we go on to talk about our next steps in children's social care, the next slide will show a short film which we developed as part and used as part of our launch in Bridgend. And included in that film, there are practitioners talking about this way of working and what it meant for them really, and what, more importantly, what it meant for children and young people and families they've worked with. And then Ian Macmillan is here today. He's a group manager, and he is also going to present some case examples as well and talk through some examples of practice where this approach has had a positive impact as well for children and young people we're involved with in Bridgend. So if we could go to the next slide, please, that would be helpful. And if we could play the video, and then we'll go over to Ian, please.
I'm really pleased that this framework has come into place. It's been 2 years in the making, really, and it's an ambition that we've had as a council for a long time. The best interests of the child and the families that we work with always have to come at the centre of everything that we do, but previously the paperwork and the procedures and the policies didn't always mould around the individuals in the way that they should. So we've put a lot of work in to look at evidence base, look at best practice across the region. It has taken a lot of work. Our office has worked really hard. I think now I'm confident that this outcomes-based model is the most effective way of working to ensure the best outcome for our children and families.
So the outcomes approach is a strengths-based or relational approach to social work. It focuses on the principles and ethos of the Social Services and Wellbeing Wales Act, that is, the principles of wellbeing, voice, choice and control, collaboration and co-production, so that's working in partnership with families, early intervention and prevention, The aim is for practitioners to have meaningful conversations with families and with children and young people to really unpick what matters to them, what's important and what they want to achieve.
Well, in my team, the Independent Reviewing Service, we're really going to benefit from this new approach. We really welcome it. It makes things a lot clearer. It puts families and children at the centre of this process, which of course is going to be beneficial. I think an outcomes-focused approach will potentially lessen the time that children's services are involved with the family. So that is certainly better for my team. I think we will hopefully see a real benefit in terms of children's names coming off the Child Protection Register more timely, because with this outcomes-focused approach, it's much easier to track progress and to evidence when change is occurring. So that clearly is beneficial to professionals in terms of their assessment, but also really beneficial to families because they can see the progress that they're making, and I think that's really important that that's recognised. So certainly for the Independent Reviewing Service, I think it's going to be really much easier for us to evidence positive change and the maintenance of that change, but also will hopefully reduce numbers, or certainly the time that children's services work with families. So I think it's going to be really beneficial. There's no grey areas with an outcome-focused approach. It's very clear about what we're trying to achieve when we work with a family. So when I supervise my staff, I'm clearer, they're clearer, exactly what we're trying to do here. So I think it's more that we'll just benefit, I will benefit from this because there's less grey areas, and that will make it easier naturally in terms of how I supervise my staff.
Foster carers play an integral part in the care that they provide to children and the support that they provide to the local authority in ensuring care plans are met. For foster carers to work in an outcome-focused way enables them to have a clear plan, a clear direction, and in doing so, that best places them then to sort of support the children in understanding, what their care plans are and sort of why those care plans have been implemented. Sometimes drift can occur in cases, so having an outcome approach to working with children sort of is quite empowering for the children. They know exactly what the plan is going to be, how it's going to be implemented, and it allows them to be sort of central to the process as well, because their views and opinions are extremely important in the care planning process. They contribute to such things such as foster care annual reviews, LAC reviews, and that's fed back to them. So quite often children who are looked after are in crisis and trauma because of their past. So having a clear plan and a direction forward will sort of undoubtedly help them.
The outcomes that we identify need to be specific, they need to be measurable, they need to be individual and unique to that child or to that family. And where possible, we need to capture those in the child or the young person's own words, or the parent's own words, so that any plan that's devised is meaningful, bespoke and specific to them. I think a real strength of the outcomes-focused approach is really how much easier it is to track progress and to evidence change. That is just really helpful for families. When you put them at the centre of a process and they feel more in control, then they're much more committed to that process of achieving change and maintaining that change, as opposed to feeling that something's being done to them.
Within a profession where there's quite often a high turnaround of social workers, having an outcome-focused plan enables that if there are a change in the social worker, that the new social worker coming in will have a clear sort of knowledge of what that plan is, how it's going to be implemented, what needs to happen to enable it to be implemented, and that's particularly important where we consider sort of permanence for young people, such as special guardianship orders. It's extremely important that permanence for children is secured in a timely manner, and if by adopting an outcome-focused approach, it enables us to plan effectively, have clear timescales and clear responsibilities for each of the persons within that sort of plan to enable it.
Managers and those with a supervisory role have received training and undertaken supervision using the outcomes model. There's a heavy emphasis on reflective practice and supporting practitioners to get to the heart of the matter and really understand the priority risks Again, it models the strengths-based approach that the outcomes model does across children's services. We need to be asking, what's working, where do we want to go, how do we get there, and how do we engage families well to do that?
This approach helps them to develop skills and puts the right support around them to be the best parents that they can be. And if their children are thriving as a result of that, then I think that's the best outcome that anybody can hope for. But in terms of the work of the Independent Reviewing Service, my team, I think for a lot of those families that we work with, a positive outcome for them will be having their child's name removed from the Child Protection Register. And this approach is helpful to them because it makes everything so much clearer. The expectations on them are clearer, so they know exactly what they need to do to achieve that. And like I said, I think any process that puts them sort of more in control, they're clearer, it is only going to be helpful and lead to successful outcomes. And of course, these are outcomes that the family themselves have identified as being required, not just professionals telling them. So, I think they're much more likely to buy into that process.
I'm really pleased to be speaking at the launch of the outcomes model in children's services here in Bridgend. I think it's so important that this model informs everything that we do, not just in the short term, but for the medium and long term. This model is about really good relationships with children and with families, understanding what matters to them, and enabling our social workers, our frontline workforce, to do what matters, and removing some of the bureaucracy, some of the systems that would have got in the way of doing the right thing. It enables us, I think, to demonstrate progress and positive change. It's very much in line with the Social Services and Wellbeing Act and doing what matters. And what it should result in for our children and families is far sooner achieving the outcomes that they want to achieve, and for us as professionals to be able to see more children remain living with their own families in their own communities, or achieving permanent outcomes, accommodation, care and support more quickly. I think this is the start of a very, very long journey, and this will be the way that we will practice, not just for the next year, couple of years, but for the next 5-10 years, and we'll see real sustainable change over that period. I think it's a fantastic opportunity for social workers to really practice in the way that they trained. We also need to see some changes in the way that our services are delivered, our commissioned services, our in-house services, so that they can respond to the really outcome-focused care plans that the social work. And I'm about that part of the journey as well as the part that we've got to date. I want to thank everybody who's been involved to date. This has been a massive piece of work across the whole department, and I'm looking forward to being part and leading that journey going forward.
We have the next slide, please. Thank you. So I'm going to give you a couple of live practice examples of where we've embedded this approach. So the first one is in respect of a young person who's got really quite complex needs. Sadly, during the pandemic, her mother's mental health deteriorated to the point where she had to come into local authority care, and care proceedings were initiated. Now, initially, when her mother became unwell, as part of her care plan, she went to live with relatives in England who lived some distance away, and we worked with that family to try and support that arrangement. But it became clear very quickly that the young person's needs were too complex to be met within that home environment over a long-term period. So what we needed to work towards in respect of the care proceedings, but also with the family, was in terms of a planned permanence. Now that young person had a significant mistrust of social workers, as did some family members, and it really needed to be some strong relationship-based practice that took place with the family. So this approach was applied well over a year by the new social worker in the case. So there was a significant level of direct work that was undertaken with the young person. Now we've got a whole suite of resources that are available to our social workers on our interactive practice guide, which they can utilise to work with children and families. So examples in this case would be the use of puppets and the free houses, the free islands resources. There was work that took place with the young person in the community. I know that picnics took place within the park, walks within the community. It was all about building that relationship. And as part of that direct work was to support the young person, because eventually their plan was going to have to be to transition into local authority care. So as part of that direct work and using that strength-based approach, but also utilising other family members and the child, we were able to assess very specifically the child's care and support needs, because this young person's got very complex needs. And that allowed us then to start to be able to match that young person with a foster carer. We drew upon the whole systems approach, so we worked with our multi-agency partners, we provided therapeutic support to the young person, and we also worked very closely with our fostering team in terms of that. So that approach was used over a significant period of time to get us to the point where this young person was able to put forward essentially what their plan was for moving to a foster carer, to the point where they had a 14 date plan, and on every day a different event would occur. So an example, in her diary, she had on day 1 she received a video call, on day 2 she received a text, and so on. And it was to the point where she'd been able to plan her transition so that she knew what car she was going to travel in on the day, what music was going to be played, and how her bedroom would be decorated when she arrived. And in using that approach, we've been able to support her in line with her outcomes, in terms of still being able to have lots of contact with her birth family in a safe way, but also to be supported and to be cared for within a placement that meets her needs. So an example of how we've been able to encapsulate that approach. Okay, next example, please. Okay, so this is an example of where we've had to manage risks whilst building on strengths, but also focusing on outcomes. So this is a case where we've got 2 children who are in the care of their father and their stepmother. The children are subject to a care order, so placement with parent regulations are in place. And on the face of it, the children would appear to be thriving in the care of their father. However, when substance misuse and drug and alcohol tests take place, it's quite clear that he's still using to excessive standards. And when the local authority has put the matter before the court has not agreed to discharge the care orders. So I chair legal surgery for care order discharges in Bridgend, and I requested that we applied this approach in terms of working with the whole family and with the children to really get a sense of what was going on within the home environment, because clearly there were some concerns, but yet that had to be balanced in terms of how these children were thriving in their father and their stepmother's care. Could I have the next slide, please? So the approach that was used primarily in terms of direct work with the children was the free houses tool, and I made reference to it in the previous example. It's one of a suite of resources, but it's a really popular one with our social workers in terms of working with children of a particular age. And so when you're using this method with children, what you're really trying to understand is their wishes and feelings on the face of it, but you also want to explore the impact of those wishes and feelings. So it's a nice way to work with children. It's a lovely bit of direct work. So for an example, in this case, the children were talking about their house of dreams. They would like to go to Disneyland. It was really clear from this piece of work in terms of the house of good things was they saw lots and lots of good things about living with their mother and stepfather, but they did have some worries, and those worries linked back to their father's sort of concerning behaviours, and the fact they were really worried they might have to come into local authority care. So once we were able to show the family that those concerns were there and those were the worries of the children within the household, we were able to put together a family group meeting and work with the family about that. So that allowed us then to balance the risks, but reduce the risk, put a safety plan together with the family, but also allow the outcomes that those children want, which was to remain in the care of their father, but with those risks reducing. Could I have the next slide, please? Okay, so in terms of the CIW assurance check in April 21, essentially they're saying that we've made some progress, and Laura acknowledged that earlier on. We're a little further behind in terms of children's care. We did make the step, and it was a difficult one to really embed this model during the pandemic, and there is work to do. And the example that I would give to you, I had the pleasure of attending the Team Development Day for our Care Experienced Children's team on Friday, and that was the team we established in September of this year. And we did some reflections at the end of the day, and certainly my end of the day reflections was it was so positive to hear social workers talking in this outcome-focused, strength-based way, with children being at the centre of their care plans. The value and ethos that shone through from the team were exactly the reasons why we created that team. So I'm hearing those conversations now on a daily basis. Probably our next steps, I know Claire's going to talk about it a little bit more on the next slide, is in terms of how we translate those conversations, those excellent pieces of work that are being undertaken, and we're actually ensure that they're on paper. So when we get regulators coming in to see what we're doing, that's actually evidenced in our practice. Okay, thank you.
Thanks, Ian. If we could just move to the next slide, please. This is the last slide, and it's just to sum up really and talk about the next steps. So the J word, the journey word, has been used several times throughout this presentation. And for want of a better word, we are on a journey with this, and every authority who has gone down this path in terms of strength-based practice will always be on a journey, because if you think you've got there, you get complacent and you stop striving for the what next. The what next for us is that we want to do some sort of service-wide reflection and evaluate where we are with strength-based practice and outcome-focused models. Strength-based practice is an overarching term, and there are different models which different authorities implement. The evidence tells us it doesn't really matter which model you use in one sense, so long as it's known and understood and drives everything you do, from practice to supervision to the way that you commission and provide services. And we just want to understand where we are against that journey, and critically that our workforce really own and are driving this service. And it's really assuring to hear what Ian just said there about the Care Experienced Children's team. I hadn't heard that before, so that's a really good measure. A really good measure is the language that you hear people use, and a really good measure is how things are recorded, and that's often one of the last pieces in the jigsaw really, that people can change the way they think, as Carmel talked about. They can change the culture and practice, but actually writing that in assessments in care and support plans in a way that is different and reflects the voice of the person can be a real challenge for professionals. And so we have got a new case recording policy and training programme which is due to be launched very shortly, and that's going to be really important in terms of continuing to embed the model of practice we've talked about. Critical to what we've talked about is our COVID recovery, and recognising that when we talked about opportunities outside of commissioned services, a lot of those stood down during COVID, so working with third sector partners and others around the restart of community provision, working with providers as we commission differently is important, and really important is the fact that we know we've got gaps in our workforce. We struggle to recruit into some critical positions, and having a permanent workforce who go on a journey over time with us here in Bridgend is critical to success. We're got what we call a toolbox to support practice. It is interactive, and we need to keep building on that and supporting practitioners to use that toolbox. And as part of our recovery planning as well, we're looking not just at those team development days, but really embedding through communities of practice across teams, and those reflective learning opportunities across teams, which are so critical to embed in. So thank you for the opportunity. Hopefully we've brought alive through the case studies, particularly what this means, and myself and the team are very, very happy to take questions.
Thanks very much, everyone, for your detailed presentation and for the report. As a committee, we've been asked to consider the contents of your report and to comment on the identified priorities. In our pre-meeting, we did have a number of questions, so if I can turn to those first. And then if anyone else on the committee has any questions, I'd ask for them to put their hand up and I'll come to them in turn. So from the pre-meeting, Councillor Gebbie first, you had some questions on the BART models and ACEs. Did you want to ask these or were they covered in the presentation? I'm just checking if Councillor Gebbie is in. She's had some problems and she did say she might dip in and out. Okay, if we move on to the next questions, then hopefully she'll come back into the meeting. Otherwise, I'll ask her questions. Councillor Gary Thomas, you mentioned sickness absence. I don't know if you want to come in on that aspect. It's all quiet here. And then, oh, sorry, Councillor White and Councillor Clark also had questions around stress. I don't know if they want to come in, otherwise I'll ask. Right, Councillor White, yes, thanks.
First of all, before I ask my question, thank you for the presentation. Very in-depth. It's a familiar model I work with away in my real job, should we say. And I very much welcome the strength approach because it does bring the best out in families, and it does go on to support the families and the workers, and it does, you know, and I've always seen nothing but success with it. So I very much welcome that approach. You know, in regards to the stress in the workplace, I know we've had COVID over the last 18 months, and recently we've had the issues with WICCUS, which I'm also familiar with. Where are we with stress within the workplace? And also, I know I have put in a referral about WICCUS and what's happening with WICCUS, but could you give a brief update on what's happening with WICCUS at the moment? How's that impacting on staff morale?
Yeah, thank you very much, Councillor White. If I take both of the questions, in terms of stress within the workplace, it is a key concern for us, and I know that scrutiny committees have considered in the past and will be due to consider again. I think that there's two natures of stress, aren't there? Work-related and non-work related, and I always think that the two are really quite interrelated, actually, in terms of how we process the challenges in our personal lives and then the challenges in work. If sometimes if you've got stress in your personal life, coming into work can be part of the respite, can't it, and support our well-being. But if work is an additional stress, we're more likely to go off sick, even if the primary reason is personal related stress. So in common with I think colleagues across the health service, colleagues in social care have been at the fore of the response to the pandemic, and we have seen the real fatigue and I guess stress related to that fatigue because of the longevity of the period of time through which we've been working in escalated and unprecedented periods of escalation. And that has contributed to significant levels of stress-related absence. We're working very, very closely with our colleagues in HR to provide support in a timely way. We're putting more investment through our social care recovery funding into stress-related counselling support for our workforce in social care to make sure that is available to individuals in a very, very timely way, and there's no delay in accessing that support if it is needed. We're also looking at the sorts of things which Ian talked about, the team development days, to give teams the time and the space to reflect and acknowledge what they've worked through, and to look at building and moving forward, as well as those sorts of community of practice approach and real focus on practice. And I see this strength-based practice as key to motivating our workforce and supporting them to be in work, but it's not to underestimate really the challenge which, you know, 18 months plus it's been now, where we've been experiencing significant challenges, and that really does mean that we've got to support our workforce when they're experiencing the stress which can be related to the challenges that they've been dealing with. In terms of our case management system, WCCIS, this is obviously a system which is used across the majority of local authorities in Wales. I think it's 17 and counting, and there has in the last month been a change in the platform that system operates on, and that change in platform, which needed to be done in order for the system to be supported, has caused some short-term significant performance issues, which have added, I must say, to the stress and strains of the workforce in undertaking the jobs that we employ them to do. One of our offers to our workforce is that they have the tools to do the job, and if your case management system isn't working, as you know, Councillor White, it is hugely difficult for staff to do their job. Thankfully, as I sit here now, the system seems to have stabilised. We've been supporting business support and other colleagues in our workforce to work more hours over time, and obviously to be supported to do that in order to catch up, and we have caught up with essential work. The system is still causing us challenges. So one of the things where we've got a bit of a backlog is around performance reporting. And we need to look at how we address that, because having performance about how we're delivering services is absolutely critical. But what we now need is a period of stability with that system, not just related to the current change of platform. There have been performance issues with the system in the last year, which have caused our workforce some stress and anxiety, as well, on top of everything else they've been dealing with. So there's very high level meetings led by the SROs for the service. Carol Shillerbeer, who's the Chief Executive of the NHS in Powys, Dave Street, who's currently the Interim Chief Executive in Caerphilly, and really holding the provider very strongly to account for performance. But it has been a real challenge over the last while. But as we sit here today, it appears to be more stable.
Can I come back to, on a good point, I noticed we get the weekly councillors do the webinars, and some of them around mental health. And do many of the social workers or people in your directorate engage in those webinars? Can I see them as a positive tool? And if they do attend them, if they do attend those webinars, is it paid? Is it like, can they do it in work time, or do they have to take time off to look at them?
Certainly during work time, I think it's really important that our colleagues have got the time in work in order to access. I run a monthly meeting of what I call the social services ambassadors, where representatives of every team come to meet with me. And in the meeting that I had last week, a number spoke very, very positively about the Care First webinars and how effective they were in supporting them. And then other colleagues within the meeting who hadn't used were listening to their peers and saying, right, I'm going to go off and actually access some of the webinars. So I think we need to continue to encourage people to do so. I haven't got any data, and I think it would be really helpful to have the data about how many of our staff are accessing, but certainly that soft intelligence through the colleagues that I meet with is that where they are being used, people are finding them very useful.
Cheers, Claire. Thank you for the answers, and I wish you well, right? Especially with kids.
Thank you, Councillor.
Right, thanks for that. In the pre-meeting, we were talking about the stress absence. We were also talking about sickness absence. So a number of members raised about the sickness, because obviously we're all aware of the shortage at the moment of carers, of social workers. And so we were questioning what the impact is then when you've got sickness as well, and how you're dealing as a directorate with not only staff shortages, but sickness as well, because that will limit your work pool even further. So I think the question was how you're managing with all of that.
Yeah, thanks very much, Chair. So in terms of sickness, we obviously work to the policies of the council. And again, it's another area where through our Social Care Recovery Fund, we've are investing some further money with HR to provide more support to managers in management. At it in detail, which I do. Long-term sickness is managed really effectively, and certainly effectively when I compare it to other authorities in terms of those who are off sick for long periods of time and managed effectively in terms of the triggers. Very few people go over that 12 months, which is not always the case in other authorities. Short-term sickness, some of it being stress related, some of it being related to COVID related absences, and then a range of other factors, obviously is a key challenge and presents real challenges to teams. So this year, because there's been lots of funding, money hasn't been the issue. Availability of workforce clearly has been an issue. So we have been supporting teams to look at bringing in additional workers where we can secure and source people of quality, which is in the agency market. So we will support agency workers to come in and support in terms of both vacancies, and where we've got vacancies due to sickness related. The challenge is that every other authority is in a similar position and fishing from the same pool in terms of agency workforce. We've obviously got major priorities in terms of trying to recruit, and we've talked about that previously in Scrutiny, haven't we, in terms of domiciliary care, but big campaigns in terms of social work as well, and a range of actions that we're looking to take to both in the short and the medium term to ensure we're in a better position around social work and social care recruitment. But in the short term, it really is looking at how we support the staff that we have, because retention is always the first part of any recruitment and retention, and then where we can secure via the various routes additional capacity, then we are looking to do that, but it is a real challenge.
Thanks. And how is our recruitment campaign coming? Are we seeing people applying for the jobs, or is there still a shortage?
We're having a little bit more success in terms of care worker recruitment. I was quite encouraged that we have 8, I think, from the last meeting I was in, people who now we're bringing forward into the care worker recruitment. We're still very challenged on social work and children's social work in particular. We're not as competitive as we need to be in terms of the salary. We have committed as a council to growing our own, and we've seconded, I think, 8 workers into the social work degree course, but that will take time to come through, and so we do need to look at some solutions in the short to medium term around social work recruitment. The sorts of things that we're starting to consider, and decisions haven't been made yet, can include areas like international recruitment, where we may be able to look at those sorts of innovations, because again, it's no consolation to us here in Bridgend or me as director, but other authorities across South Wales are in the same position, and so there are no easy answers. So we need to look at every possible opportunity that there is, recognising that some of the more medium-term solutions will take a number of years.
Okay, great, thanks. I see Councillor David White wants to come in.
Just on that question, how many agency staff are we employing at the moment from agencies? Are we employing any agency staff at the moment? Because I know that's a good sign, regarding recruitment. But I do welcome the work that you're all doing around, encouraging, workers to do the social degree course, and and to bring. I think that's a fantastic, because it gives incentives, and it gives, lots of incentives for the workers to stay, because they can see a chain there where they can climb a ladder and work on, become social. But like you said, it's a long-term investment that takes. But I do welcome it. But I always say I could judge local authorities, how many agency workers are they employing at the moment, and the extra costs that go with that?
Yeah, I don't know the exact number, Councillor White. Laura, do you know in children's services? I don't want to put you on the spot either, but and Ian's got his hand up as well in terms of exact numbers.
Yeah, I think so. In terms of specifically in terms of social work roles, it will be, I think, probably 10 in post now, but maybe 11 by the end of the week.
Thanks, Ian. And we will have a small number as well in adult services. And I'm not going to put Carmel on the spot, although if she wants to volunteer to answer, she can. But we can come back to you with the exact figure.
It's about three there. We were seeking to recruit more, but of course we can't recruit them from agencies either.
I think Laura's got her hand up as well, hasn't she?
Yeah, I just wanted to sort of add a bit of context, Councillor White, in that Ian's just helpfully given an approximate number, and just to outline as well, that's not just in case management as well. I think the workforce pressures in children's social care across Wales now are going beyond what historically has been primarily in case management, but we're experiencing some pressures in other parts of the service as well. So the agency staff are in, our front door case management teams and fostering as well. But that isn't just because of unfilled vacancies. It's because of other issues that we've just referenced, like sickness absence and things as well, and long-term issues people are experiencing. So, but we can provide you with a bit more detail about that as well.
Thanks. Does that answer your query, Councillor White? You're on mute.
Thank you. I had to be the first. I had to be the first to do it in the meeting. But thank you for your input and thank you for the answers.
Great. I've got Councillor Martin Jones. Do you want to come in on this?
Everybody, and thank you, Chair. Can I first of all apologise for not being able to make the pre-meet this morning? Can I congratulate the Directorate on their presentation and their report? It's always good, I think, to see examples of delivery. I think that humanises the whole process. And I certainly, as an individual member, benefit from listening to these examples. My contribution to this discussion, if I may, is very much based on improving my understanding of what the demand is on adult and children services. We briefly in the last discussion talked about an increase in case management, but as a lay person and a public representative, it would benefit me, I think, to have a greater understanding on demand. For example, are there any demographic variations across the county in relation to demand of adult and children's services, and has vulnerability been increased as a result of the pandemic? We can all sit here this morning and say, yes, it has, but where has it increased? And I think this is very important from the Directorate's perspective, because, of course, it then takes us to the other issue of capability and capacity of the Directorate to deliver, and, of course, budget management to make that delivery happen. So just to round up on where I'm coming from is, and it's an observation which perhaps the Directorate can consider for further meetings, is perhaps give us a better understanding and insight into demand and your case management responsibilities. And I think that is something which the public perhaps would welcome, because of course when we enter the budget planning process post-Christmas, the public would need to know that perhaps if there is any increase in precept, and I say this having no information at all to suggest that it would, then the public would know that increases are being put in place to meet demand. I hope this all makes sense. I can see that Claire Marchant is nodding her head, Claire, but I think you know what the demand is, your team know what the demand is, but I'm afraid I don't think many other people know that demand, and I think we can support you perhaps that little bit better if we have a better understanding and knowledge of what the demand actually looks like. Thank you, Chair.
Thanks very much. Don't you want to come back on that, Claire?
Yeah, thank you very much for the question, Councillor Jones. I think it is a really important question, and I think we would welcome the opportunity to come back to you actually with some of that detail in a report around that demand that's coming through front door of both adults and children's services. I was just looking at our adult dashboard. There were 131 contacts with adult services last week compared with 98 at the same time last year. So that gives you a sense in terms of the quantum. In terms of domiciliary care, we know we're providing around 8% more despite the challenges that we're facing in terms of recruiting into the sector than we were in the previous year. But we know that we're not meeting the need and demand for service that there is, and we've got people waiting for domiciliary care and waiting longer periods of time for domiciliary care. Equally in children's services, we're seeing an increase in contacts. I've not got the dashboard in front of me. Laura may well have it in front of her to give you the headline number, but we're also seeing, and this is a word that is used a lot, and it's important that we don't use it lightly, we're seeing an increase in complexity in casework, both in adults and children's services. We're managing increasing risks, some of that because of availability of usual solutions and availability of care, and because of the impact of the pandemic on individuals and families. Some of those impacts were short term, and some of them longer term. You know, people have had delays in having NHS treatments that can cause their need for care to increase. The Health Board are now restarting their NHS treatments, which is great, and some of that is being outsourced into private providers. From them, that's increasing the need of post-surgical need for care for us. So it feels like a perfect storm. And in addition to that, there are the usual demographics, which I know you will have heard about for many years and has been reflected in budget pressures. So we would welcome, I think, the opportunity to bring back a report which sets all that out in measured and granular detail for you to consider as a scrutiny committee.
Thanks very much. Did you want to come back, Councillor Jones, or are you happy with that?
No, Chair, I just wanted to perhaps make one additional comment, and that is, of course, is sharing the responsibility, sharing the problem. It's not solely the Directorate's responsibility here. We as elected members obviously have a shared responsibility to understand and support. So I would welcome that report. Thank you.
Thanks very much. Before I go into Councillor Gebby's questions, and I've got some questions, has anyone else got a question they'd like to ask? Just wait and see if any hands come up. There's nothing coming up at the moment. So I'll try and, oh, sorry, Laura Kinsey, did you want to come in?
Yeah, sorry, I'm having some Wi-Fi difficulties, so I couldn't get my hand up, and I was trying just to sort of reiterate what I'm saying really in terms of the increased volume as indicated. That is emerging as an issue now. We've been cautious about saying that it was a consistent issue over the course of this year, and because it's been up and down, and we've been carefully monitoring and analysing our sort of, referral trends, etc. But just to reference, for example, last week, in terms of our weekly returns to Welsh Government in children's social care, we received 138 contacts, and that compared to 80 contacts in the same period last year. So I think that demonstrated in one particular week that we were definitely seeing an increase in demand, and that is emerging as a trend now as well. And I think, as Claire has indicated, we'd welcome the opportunity to bring back much more detailed information about that as well and have that conversation.
Thanks very much. Right, if I apologies, I'm going to try and ask this question with that Councillor Gebby raised. She wanted to know, we discussed in the pre-meeting about ACEs, and then there was a new model. So she wanted to know why we keep changing the models. There was an introduction of the BART model, and do they link together? Because she wasn't sure if there was evidence to suggest that they were. So apologies if I've got that wrong, but that's the notes I took when we were asking the questions in the pre-meet. If anyone can answer that, please.
Okay, yes, I'll answer that. I'm Claire Holt, Workforce Development Manager for Social Care. Yes, so in terms of our BART model and ACEs, Adverse Childhood Experiences, is interlinked. So it's not a separate separate model. And the BART model was developed to support staff to explore and deliver trauma-informed practice to children. So recognising the children have, the children that we're working with, many of them have suffered adverse childhood experiences, which has affected their emotional development, their physical development, their attachment to significant others. So the model works alongside the ACEs model, and we have a number of colleagues in our education services who trained up as ACE practitioners, and they support the directorate, the Social Services and Wellbeing Directorate, in training staff on understanding adverse childhood experiences. And then we've been working with our residential and foster carers as well to assist them to understand how trauma impacts on behaviours. So they are interlinked. They're not a separate model, and we're developing as we move forward with outcome focused practice. It's all interlinked as well. So if Councillor Gebbie wanted, we do have a briefing paper on BART and ACEs that we could provide.
Okay, great. Thanks very much for that. Anyone got any questions before I run into the few questions that I've got? If I start, and if you've got a question, if you raise your hand, then I'll come to you. But from the presentation, it was a great presentation, thanks for giving us a lot of information. We said about the welfare calls, and we're more proactive, and the news is consistently saying that loneliness and mental health has increased. So have we seen an increase with this as well? That's the first question. That was on the first half of the report on adult services.
Carmel, do you want to come in and give your reflection on that question?
I think the challenges of the pandemic, initially we were all hands down. How are we going to support people who are very vulnerable, who were worried about people coming into their homes, and finding different ways to work with people and resource that. We are now, 18 months, 2 years on, or coming towards 2 years on, and we are seeing, if you like, the after effects of people who have been isolated through no faults of their own, who have struggled with the restrictions, like the young man in the case example. And we are working collaboratively with the Health Board around mental health and wellbeing offers. But people, unfortunately, particularly for older adults, the pandemic has meant that people haven't been as active, and there's less community offer, and they have sort of decompensated in terms of their abilities, and they are presenting with multiple and quite complex needs, in the sense that their ability has become impacted by the pandemic, but also our ability to support them to do things differently, to improve their well-being. The offer is also has been significantly limited. So where we are now is our social work practitioners, and this is part of the reason why we need more capacity around social work. They are the resource, they are the community care response to a lot of people until other resources reopen, and they are using their skills, which do include communication, counselling and others, to support people in situations that we haven't had before. So I think the reality of the situation, particularly in adult services, is that people have been disconnected and sometimes dislocated from community, and this has been impacted on by the impact physically of the pandemic, as well as on people's mental health and well-being. To support them, it's actually become more challenging because it's taking more time, and it's taking it's kind of iterative in trying to support people to have confidence again and to look at their issues. So the Cwmtaf Morgannwg Health Board have made significant investments in wellbeing support to the public, and we also have our partnership in terms of the assisted recovery in the community, our ARC centre, where people can present to get support from integrated health and social care services. But I think this is an area where we are going to probably have to strategically do more work, because I don't know if the full impact of it has been collated for us. It would be the honest answer.
Okay, thanks very much. And you might be able to answer this next question I've got as well, because it links into that. You said the gentleman in the video had required 105 hours initially of care, and that's gone down significantly. But where are we with patients discharging from hospital requiring care packages? Because who assesses the amount of hours that are required there? And then obviously if we've got a lack of carers, we're going to struggle then potentially to provide significant levels. Do we reassess the hours that's needed, or do we work together with the health board?
So we have a discharge to assess and recover model approach embedded in our short-term services in our community resource team. So we have trusted assessors within the hospital who support, as well as social work staff in the hospital, around people's potential to improve and recover through programmes of enabling and re-abling support. So if in a perfect world, the flow would be that people would come into those assessment services, have a programme of re-ablement, and which is non-selective mainly. So we're not looking for people who need functional improvement, although we do offer that. We primarily focus on enabling people to live independently as possible, and that might be their environment or that might be their physical abilities. So in a perfect world, they come through that programme of support, and current performance was around 60% plus of those people would go on to have no ongoing care needs, because we'd have taken them from an assessed need for care and improved their function and ability through that programme of support. Some of those people can't be fully made independent, and they often go on to need care and support at home. And in the current environment where there is challenge getting domiciliary care, which I know that you are aware of, this is actually having quite a challenge for us to get that flow through. So we have been looking at other options with families, using direct payments more creatively, where we would perhaps more routinely have used domiciliary care agencies. But in reality, it is significantly challenging at the moment. We're hoping obviously the system will rebalance with the work we're doing with Welsh Government to recruit and improve people coming into our service, but it's not a short-term fix for the immediate problem for people who are waiting care. And as Claire has already advised, there are people waiting for packages of care in the hospital as we speak.
Thanks very much. My final question actually follows on nicely from one of your answers as well. It's what support, and this also relates to the children's services as well, what support or courses are available for families to step in and become carers? Do we provide any specific training or any support or advice or anything that would enable them to step in as the carer?
I suspect my colleagues from our trainings team would be better placed to answer this. So I don't know if Claire or Dave want to answer.
Oh, hi, yes, Claire Holt again. Yeah, Dave would probably be a best person to answer from an adult perspective. In terms of courses specifically for carers, we don't provide specific courses for carers in taking on care and responsibilities, but we have our carers wellbeing service that supports carers, where we do run events. For example, we've got an event on Monday for parent carers of those who are caring for disabled children, and that's around listening to carers about what their particular needs are, and obviously all carers are entitled to a support assessment as well. So if there were any identified needs then in terms of additional support, with regard to any practical support in terms of, say, for example, physically handling their individual. Sorry. and it's sorry, I don't know. I haven't worked out how to switch it off from getting the new Microsoft Office on. Yeah, so we work with colleagues, for example, our occupational therapy colleagues, to enable them to support on a one-to-one basis, to provide instruction on how to sort of move and handle individual their child or their spouse. Yeah, so Dave, if you could come in here, because you're more actively involved than I am.
Yeah, Dave McManus, I'm a workforce development officer in Scadoop. There's three aspects to that question, I think, in terms of adults. And any support a carer might require should be identified following a carer's assessment of their own well-being, and that would include, of course, what support they need in order to continue to offer care to their loved one if that's the direction they wish to go in. So any individual support can then be followed up through any allied support services that the carer might be able to access. And then the carer's support service itself potentially would be able to discuss and maybe identify other forms of support. We have experience and welcome any requests from informal carers to access any training that we might be arranging. We don't have a significant number of carers coming forward, but where we are approached to assist, we will seek to support a carer to obtain a place on any training that's relevant for them in relation to the needs that have been identified.
Okay, thanks. Because I think my point of view is coming from more like the manual handling of particularly adults. Obviously, if a spouse, for example, is going to become the carer and they've got to manually handle the other person, you don't want the two of them ending up injured, because then you've got two additional people that would potentially be requiring the care package, rather than one. It's just making sure that they're able to just, because it's not just feed them and do, caring as a whole host of, depends on the abilities of that individual and what is required to look after them.
Yes, if I could come in there with regard to manual handling. The manual handling passport course that we run for our staff is considered maybe too generic for individual carers. So that's why we work with OTs so that they tailor the advice to as best move and handle the person they are caring for, and that will be part of a wider assessment in terms of any equipment that's needed, rather than than the 10 to 2 day course, which won't necessarily cover the specifics for that for the individual person that they are caring for. And our OT service work alongside the service and us to support that.
Great, thanks.
Yes. Sorry, if I might just add to what Claire has said, that obviously for informal carers, their environment, where they live, how their furniture is set out, what the layout of their house is, are very important aspects and can impact upon manual handling in terms of the location of equipment and whether indeed the house can accommodate equipment. So it's important that individual informal carers, that assessment takes place in their own home, really.
Great, thanks. And I think it's for us as members, if we go back to Councillor Martin Jones's questions with regards to exactly what the pressures are on the directorate and staff, and so that we know the struggles, we know the figures, we know, and I think that's where we're coming from with this sickness absence as well, is what we as members can do to support the directorate and what we can recommend from here. And if we've been supporting and sharing the recruitment drive, but if there's information that we go out and provide residents with regards to the family members becoming carers, I think everything like this would benefit if we had more information so that we could go out and support the directorate further. Have we got any other questions for the officers? I can't see anything else coming up. Okay, well, thanks ever so much for your time. I know it's all how busy you all are, and I appreciate the comprehensive report and the presentation. Did you want to come in, sorry, Claire, before I let you go?
But only to say thank you very much, Chair, and to the whole of the Scrutiny Committee, and to thank you for those comments you just made there. Then in detailed information important. We bring that forward to you because trying to manage the level of scale of need and demand without highlighting it and escalating it and making sure it's well understood isn't the right thing for us to be doing as a directorate. So I think we will certainly make sure that we get that granular detail to you so that you can support the need for investment in social care in Wales, because there's a lot of discussion happening at the moment around this, and it's clear that we need long-term sustainable investment, not just to address the short-term very specific COVID-related issues, but the long-term systemic issues which social care is facing. So just to very much as professional lead within the authority to welcome those comments.
Great, thanks very much, and thanks again for all your time. If the officers want to leave now, you can do and get back to the normal day job. Thanks very much. Councillor White, did you want to come in here? Councillor White, got your hand up on my screen.
Yeah, it's a message from Jane Gebby to say that the Wi-Fi's not working, so can it be noted?
Yeah, she did say in our pre-meeting that she was having problems this morning as well. Okay, great, thanks. Has anyone got any comments from there? From the report? Did you want to speak?
I thought it was a very, very good. The presentation was brilliant, and to see some of the success, of the practices, and of course, we recognise, for every good practices, and other times, there's more difficult cases that they're not, that there needs more work on. But I think, this strength-based process, I think, is a really, really good tool to use, and it seems to be having success. So hopefully, there'll be more good stories coming from this. Yeah. And it seems to be helping the practice, helping the families, but more importantly, it's helping as important as it's helping the practitioners as well. So hopefully it'll go from success to success.
Yeah, great, thanks. Councillor Jones.
Yeah, thank you, Chair. If you look at paragraph 9.1 of the report, which asks us to consider the contents of the report, which we've done.
Yeah.
And then it also asks us to comment on the identified priorities, which we have done. But perhaps that is very apt then to bring in our suggestion that we have a far more broader briefing on demand, so we can better understand the complex priorities that are in place. Sorry, the priorities that are in place to meet the complex demands being placed on both directorates. That's the adult and children's services.
Yeah, great, thanks. Councillor Thomas, did you want to come in on this as well?
I thought it was a very comprehensive report. I enjoyed it, and it didn't drag along as I thought it would this morning.
Yeah.
It went really quickly, and I'd like to thank the officers and yourself for chairing the meeting and the chair.
But I think from our pre-meet, and that's where we were coming from. I think Councillor Martin Jones wasn't in that, but that's where we were coming from, I think, with the sickness and why we wanted these figures, because we wanted to appreciate exactly where the problems were, where the issues were, and it wasn't just to obtain sickness, it was to see how we could support the directorate, what we can do, and so that we've got a better idea of the position that they're in, rather than just asking for sickness. It was to support, and I think this is what we need to do, is look at ways we can support the directorate, because we've established that they're under an immense amount of pressure, and that we are throughout Wales under pressure with regards to recruitment. So I think if we could ask for this this additional report to come back with all the further information that Councillor Martin Jones suggested as well, we could then look at, as a committee, what we can recommend as support from this.
Thank you, Chair.
Yeah.
Thanks very much, Yes.
So is everyone happy with that? If we go back now and wait for this.
Amanda,
Yeah.
I've always said, I'd like to know, I know each different case has its own different complexes, and you know, you certainly go on a significant figure. But I'd like to know how many cases on average does each social worker hold, or each support worker hold, right?
Yeah.
And I know like some cases can be more complex because it could be in the court arena, or it could be in child protection, it could be looked after, you know, and it could be significant complexes within the case, right? But is there any aspirations, you know, to identify how many cases should a social worker hold, and are they meeting those aspirations? If not, what can they do about it, you know?
Yeah.
But a ballpoint figure, let's say of 14 cases, you know, it's not the real answer, because like I said, there could be like complex cases in each family, and sometimes 5 cases, working with 5 families could be just as busy as somebody with 14 cases.
Yeah.
You know, depends what's happening on the family, but I like, you know, to see whether they could work it out, whether they do case holders numbers.
Great. Okay, Meryl and Lucy, could we potentially go back to the directorate and ask when they're going to present this additional report with the information, that we could ask for how many cases that individuals are holding, and also how many they should hold?
Yeah, I've got that.
Great, thanks. Councillor Bacella, did you want to say something? Just saw you on screen.
Thank you, Chair. My internet actually went down and I've just reconnected. But no, I don't have any questions, thanks.
Okay, no problem. So from here then we'll await this additional report with more information, and then and also the details of how many cases, and then we can look at what we could potentially do to support the directorate as well. Is that what I'm getting from this? So if that's the case, we've just been asked to comment on the report. I think we've given our comments, and we could move on then to the next item, which would be the forward work programme. Okay, I think forward work programme scrutiny officer is going to go through this. So, Meryl, you're going to do it. Thanks.
Thank you, Chair. Following on from members' consideration of the forward work programme at the last meeting in September, the latest forward work programme for this committee is attached as Appendix A. The forward work programme will be included in the report to Corporate Overview and Scrutiny Committee with any updates from the meeting. The recommendations monitoring action sheet for the previous meeting is attached as Appendix B and tracks the responses to the committee's recommendations at previous meetings. And the recommendations are set out in paragraph 9, Chair, page 22 of the report. So I'll hand back to you for any questions.
Yep, great. Does anyone have any questions on the forward work programme? I think it shows that the next meeting will be, is it January now, because the one from December has been moved, is that right?
I think, Chair, with you're correct. We have asked for other items for the December meeting, but I think because we will be actually having to have additional meetings in January for those for the budget, we're just waiting on clarification of whether there'll be items coming forward, or if the meetings will just be postponed until the new dates in January. But that will be subject to an announcement at council and agreement. So that's why we haven't changed the report, the work programme yet.
And then we've just agreed in the last item that we'll have a further report as well from social services. So it's when that will come into the
we will add that to the work programme and consult with the director on the timing.
yeah, so we need to put that in there somewhere. But apart from that, has anyone got any comments on the forward work programme, or are you happy to approve it as it is?
I'd like to move it, Chair.
Okay, thanks. Everyone happy?
Yes, thank you, Chair.
Great, okay, well that's that then, we've approved that. And then we're on to agenda item number 6, which is urgent items, and I don't think there's any urgent items in accordance with part 4 of the council procedure rules. So in that case, we can now bring this meeting to a close. I thank everyone for attending.
Thank you very much, Chair. You take care.
Thank you, Chair.
Thanks very much.
Thank you, Chair. Thank you.
Thanks. Bye.
Yeah,
Thank you, Chair.